Hello, this is Dr. Wendy Wood with a recorded lecture on elder abuse, caregiver issues, and dying. And I would like to acknowledge Dr. Kathy Lesnick, PT, for this PowerPoint. First of all, I would like to begin with some statistics. In 1999, the number of elders abused in all categories was about 2.5 million, and we'll talk about the categories later on. The median age of elder abuse victims was 77.9 years. Two-thirds of abusers are family members. Two-thirds of abused are female. And of every reported incident, there are 14 unreported. So this is very much unreported. So some of the categories of abuse: domestic elder abuse. Majority of abuse cases occur in the home. Institutional elder abuse is most common, with bed sores, preventable accidents, and failure to provide medical care, about 4%. And then there's self-neglect or self-abuse. Types of elder abuse: physical elder abuse, about 15%. Any physical pain, injury inflicted by a person who has care or custody of the elderly or is in a position of trust, that would be considered to be elder abuse. And that does include unreasonable restraints. Some of the indicators would be cuts, wounds, poor skin condition or hygiene, bruises, welts, or discoloration, or injuries not consistent with the patient's history, the absence of hair, bruising of the scalp, dehydration or malnutrition without illness related to that, and burns. Sexual abuse is a relatively low percentage, about 0.3%, and of course that's considered non-consensual sexual contact of any kind. Some of the indicators are bruises around the breast and the genitals, unexplained venereal disease or infections, anal bleeding, or torn or stained underwear. Financial abuse is another type of abuse, and that's about 12.3%, and that's theft or misuse of the elder's money or property by the caregiver in trust. Some of the indicators are unusual or inappropriate bank activity, forged signatures, changes to legal documents the elder is not capable of making, or inappropriate transfer of property or funds. Types of abuse: neglect is about 55%. It's the failure of any person having the care or custody of the elder to provide care which is reasonable to the person. That would be active neglect, willful failure to fulfill caregiver functions, or passive neglect, non-willful failure because of inadequate inability. Some of the indicators are odor, poor hygiene or other safety standards, rashes, sores, lice, soiled clothing, or malnourishment or dehydration. Self-neglect includes inattention to self. Assess the elder's ability to choose the lifestyle. Some of the indicators are inability to manage finances, not attending to medical needs or dangerous living condition, or changes in intellectual function. Psychological or emotional abuse is about 7.7%, and that's willful infliction of mental suffering. Some of the indicators are helplessness, fear, withdrawal, depression, denial, implausible stories, confusion, or disorientation. Who are the abusers? 19.3% are spouses. However, the highest percentage of abusers are the adult child, awfully financially dependent on the elder and or addicted. The institution, about 4%, unrelated caregiver, 24%, or other, about 4.4%. Some of the risk factors of abusers: stress, alcoholism, violence, emotions, or dependency. Signs a caregiver is abuser: prevents the elder from speaking, prevents the elder from having visitors, anger, indifference, or aggressive behavior, history of substance abuse, mental illness, or criminal behavior, history of family violence, defensiveness by the caregiver. What should you do? If the threat is imminent, call the police. California law requires healthcare providers to report suspected abuse. These are some of the phone lines you should be familiar of depending on where you're working. You need to submit a written report within 2 days. These things are constantly being updated, so you may check on any changes, but you really need to report things right away. In the institution, you report to the administration, local Department of Health Services, or law enforcement. Failure to report is considered malpractice, a fine of $1,000 or jail of 6 months. If the report is determined unfounded, no penalty. The identity of those filing the report is also confidential. So let's talk a little bit about, we're going to talk now about hospice or rehab. We're going to talk about patients in medical care that may be candidates for hospice. Okay, death, it's a normal process, and it's usually the expected outcome of a terminal illness or end-stage chronic illness. As a process, there are recognizable signs. So there's a pre-active phase and an active phase. In the pre-active phase, there are increased restlessness, confusion, agitation, withdrawal from participation in social activities, increased periods of sleep and lethargy, decreased food and fluid intake, rapid weight loss, and loss of appetite. The patient may want to see family and friends to take care of business. And typically here, wounds and infections aren't healing or healing very slowly. There may be an increased swelling of the extremities. In the active phase of dying, there's an increased ability to arouse the patient. The patient may be very agitated. There may be extreme respiratory congestion or fluid buildup, and the patient may state that they are dying. The patient may no longer be able to speak, and there's usually severe loss of appetite or little or no food intake. The extremities tend to feel cold and blue in appearance. Physical therapy for the dying patient. First of all, symptom management, comfort, assistive devices as condition changes. Be aware of the patient's pain. Know the code status. Recommended referral to hospice, carefully talking to the patients, the family, and the doctor to see whether patients are ready, whether family is ready. The most current term is palliative care. Now, there really is a distinction, however, between palliative care and hospice. Palliative care is usually before hospice, but there's often no timelines on this, and people do sometimes actually come off of hospice. So in that case, maybe they've somehow had recovery. So these are important things that these conversations are usually very important and delicate. Thank you very much. That is the end of this recorded lecture.